As of today, almost half of U.S. adults are fully vaccinated. And while we have a lot of work left yet to do to reach communities who still can't get vaccines and reassure people who still have many questions about them, we can see the light at the end of the tunnel. And I really want to thank all of our witnesses, especially Dr. Collins and Dr. Fauci, for putting in long hours and putting science first. Where we are at today is a testament to the tireless work scientists at NIH have been doing to study this disease and how we can best fight it, and to oversee clinical trials for vaccines and therapeutics and more to ensure they are safe and effective. And of course, as our witnesses know, our historically fast progress in fighting COVID-19 and developing safe and effective vaccines was actually years in the making. The pace of discovery we've seen this past year was made possible by research into mRNA vaccines we funded in response to Ebola and other viruses, and by a biomedical research enterprise that has been built over decades to become one of the most cutting edge in the world. This should be an important reminder when it comes to biomedical research. You can never fully predict how the discoveries of today will prepare you for the challenges of tomorrow. That's why you have to build a robust research enterprise and recruit diverse world-class talent and make sure scientists can do their work free from political interference. And President Biden's budget, which proposes over $40 billion for NIH and the largest increase in the agency's history, will go a long ways towards making sure we can continue to prioritize this. This budget will reinforce our work to fight COVID-19, along with many other diseases and disorders that threaten families in my home state of Washington or Missouri or across the country. It includes funding to improve treatments for addiction and substance use disorders, and funding to aid the fight against cancer, Alzheimer's disease, and rare diseases families across the country are grappling with. President Biden's budget request will also fund research to help us study the health effects of climate change, which may be increasing the number of infectious disease outbreaks, identify solutions to gun violence, which continues to claim tens of thousands of lives each year in this country, and root out the health inequities in our country, which are undermining the health of people of color, people with disabilities, rural communities, those paid low incomes, and more. The President has also proposed $6.5 billion for a new initiative, the Advanced Research Projects Agency for Health. Like the Defense Initiative, it is inspired by ARPA-H. ARPA-H is envisioned as breaking the mold for how cutting-edge research is conducted, speeding up the development of medical treatments by funding innovative projects. I'm interested to hear more about how it can add to NIH's work and operate as something truly distinct from its other traditional biomedical research programs. Of course, at the end of the day, innovation isn't just driven by new programs and new investments. It is driven by people, which is why with as much as we invest in NIH each year and as important as its work to its families, our families, we cannot afford to have this agency's potential limited or its success threatened by bias, discrimination, harassment, or assault in the workplace. Unfortunately, we know that in the biomedical research community, the prevalence of researchers of color is too low, and the prevalence of sexual harassment is too high. These are real problems with real consequences for biomedical research and the people who do the life-saving work we're all benefiting from today. I commend NIH for the efforts it has taken on both of these fronts so far. NIH has done work to examine barriers to diversity among its researcher ranks and how its own practices have reinforced structural biases that allow discrimination to persist. But more work remains to tear down barriers and create lasting change. And when it comes to sexual assault, Director Collins, I'm glad you've taken some forceful action to address the problem among the NIH workforce, but NIH must do more to use its enormous influence with the research community to enforce change in the nation's universities and research institutions. I expect NIH to continue building on its efforts so far to remove racism, discrimination, and harassment from research, and I will continue to follow up on that progress. Finally, as proud as we all are of our nation's biomedical research institutions, we don't invest billions of dollars in biomedical research out of pride, nor do we invest in them to help pharmaceutical companies make astronomical profits. We do it to bring new treatments, cures, and hope to people across the country and across the world. It is important that we never lose sight of this, because even the most brilliant miracle cure can only save people if they can actually get it. Just as I hope to work with my colleagues on both sides of the aisle to make life-saving investments in biomedical research like those proposed in the President's budget, I also hope we can work together to bring down the cost of health care, especially for prescription drugs, keep working towards universal health coverage, and bring the cures we are investing in to the families who need them.